Hey, it's Jessica DaMassa with WTF Health. I'm here at AHIP's Consumer Experience and Digital Health Forum, and joining me right now I have Hill Ferguson. He is the CEO of Doctor On Demand. So Hill, welcome. Good to talk to you.
Thank you. Good to talk to you, Jessica.
All right, so I understand that you've got an interesting take on primary care, and specifically how telehealth can help kind of disrupt the way that we're delivering primary care, which you say also is broken. So unpack this for me a little bit, Hill. We'll just take this all out of your mouth and make you explain yourself.
Sure. Well, telemedicine's been around for years. I think our opportunity as an industry is to expand that format and that platform into the heart of what I perceive to be the core root cause problem of our healthcare system, which is lack of access to primary care.
Okay.
So today, 30% of adults don't have primary care physicians. It's even larger when you get into millennial populations.
Yeah, sure.
50% of millennials don't have a primary care doctor.
And I bet the 50% that do are like forced to pick it as part of their insurance plan.
Probably. Okay. But the point is that trend is going in the wrong direction, and it's only going to get worse as by the time 2030 rolls around, we're going to have 100,000 physicians fewer than we need to service our growing population. And the price that we pay for all this is just exorbitant costs in chronic care, chronic conditions going out of control. And so we think that using telehealth as a way to provide better primary care access will actually do more in the early stages to prevent chronic diseases, to actually deliver that quarterback for your health that every one of us needs. And you shouldn't have to wait 3 weeks to go see a doctor. Everyone should have access to a primary care doctor.
Well, not even just waiting, but a lot of times people just won't go to the doctor because they're like, don't have the time to do this. It's not that big of an issue. And then all of a sudden, months, days, years go by, and it is a big issue, right?
Well, we've been conditioned because every time we go into the healthcare system, it's painful. Yeah. Right? Not only do you have to wait, you have to spend a lot of money, and is it worth it for a lot of people to do that? And so what ends up dropping off the list first is preventative care. Right. And that's actually the most important, and that's what gets dropped first. And so our belief is that if you give people greater access to primary care, they'll actually do the preventative care. Yeah.
I think a lot of people are trying to throw apps at preventative care. And so, I'm curious to know, why, what do you think the differentiator is going to be for throwing telemed at it instead?
Sure. Well,
how is that going to help get better adoption and get people to actually do the preventative care stuff?
I think the key is simplicity and ease of use and partnership with health plans. Okay. So there are myriad of point solutions in digital health, right? In the last 10 years, you've seen hundreds of companies being funded to solve this problem or that problem. They all are problems that result from lack of access to primary care. So my view is, let's just fix primary care. Okay. Because if we give everyone access to a good primary care doctor in a few minutes versus making them wait weeks, they'll be able to head off chronic conditions. They'll be able to do preventative care. They'll be able to better navigate the healthcare system with a physician quarterbacking their health versus an app or some content or some tools or some AI.
Okay, so talk to me about how you guys are doing this at Doctor On Demand. And you're back up to, for a second, and explain your model real quick, because it's different than other telemedicine companies that I've talked to. So I want you to talk a little bit about your model first, and then I'll ask you the question I was going to ask.
That's right. We're a national platform of fully employed primary care doctors and integrated mental health specialists.
Okay, so that stop right there is different, that you guys employ your own physicians. So keep going.
Correct. So we employ all of our physicians, about 60% are full-time, 40% are part-time. That allows us to deliver, number one, on the promise of continuity of care. So if you find a doctor that you really like, they're going to be there when you come back.
Yeah, you can pick them, right?
Exactly. Our platform is built to integrate into specialists as well. So our first specialty that we've integrated is mental health. Mm-hmm. This is a really important part to the long-term solution of our system's problems, is not having the ability to treat the whole person, right? And what happens is the patients get treated just bits and pieces, and the brain's treated differently than the body, and it just shouldn't be that way. And so we start with having a single patient profile that can be shared among a variety of clinicians, both in our practice and also in brick and mortar, so that patients get the benefit of continuity of care.
Okay. Now, if we switch the primary care to a telemedicine situation, what does that do? For, I guess, the healthcare cost of this. It's right now, it's a lot of people don't utilize their primary care doctor, and then there's a part of the industry that benefits over the fact that they're not using it, at least in the short term. And a lot of times now, I think especially, we're looking at short term. And they always say, preventative is so hard to get funded because it's I'm not paying for that right now for this member or this patient or whatever, because I'm not going to reap the ROI on it, because I'm not going to see it for 3-4 years down the line. So what would your argument for that be?
Well, I think that's a fundamental problem of the incentives in our system. Parking that aside for a moment, I think we do have near-term paybacks and near-term ROIs in our model, because what we're doing is we're replacing a high-cost visit to the ER, to the urgent care, even to an in-office facility, and we're saving hundreds of dollars per visit every time people use our service. So the payback is in year. It's right in front of you. So you don't have to believe that you'll even get an ROI for the preventative, because you're going to get that for free, effectively. But I do think there are a lot of populations, particularly when you get into government programs and Medicare Advantage in particular, where having the payer relationship is likely to be longer, and even in the employer populations of groups that are likely to stay with their company for more than 18 months, employers are willing to invest in preventative care, right? They've shown and demonstrated a willingness to do that. And so I do think there's an appetite to invest in it. You just got to get a better return for it, and you have to show that you're getting results. It can't be a simple, biometric, take these results to your primary care, and we'll give you your $50 incentive and see you later. You need to actually feed the data into a profile, have a visit right then, right there.
All right, Hill, tell us about your data then. So how many people you got on your platform, and what are some of the outcomes you're seeing?
Sure. Well, our platform's open to everyone. So to be clear,
what does that mean?
It works with or without insurance or a covered benefit. So anyone can use it. Right now, about 32 million people in the U.S. have a covered benefit associated with Doctor on Demand. So we tend to focus in that pool. And those are the members of large health plans that we work with, as well as self-insured employers.
So on the platform you have, how many people using you?
We have millions of patients and over 30 million total available
to be users. Got it. Okay, cool. And what kind of utilization are you seeing? So there's somebody published a study, I wish I could find this again, but that it's like telehealth is just not being utilized the way that the industry had hoped or thought it was going to be used. That chat is really popular, that like email, text, those kinds of things, like things that don't involve video. And I know you guys are video based. So, have you been seeing that? Or is there not has your uptake been like?
Yeah, so we built our company around the idea that we only really want to drive value in the form of utilization. And what that means is most of our customers are paying us, per visit. And so as we scale and as we grow, those models will change, but we fundamentally built a system that is easy to use, that is focused on delighting the patient and encouraging repeat usage. And so right now what we see in our employer population, they're getting to 10% utilization rates in year 1, beyond 20 in year 2, and so on and so forth. It's growing. And then in the health plan populations, it's not as good. It's usually in single digits.
Why do you think that is?
I think health plans typically have more of a distance relationship with their members. So if you think about it as an employee, hey, this person is creating my job for me and paying me, and they're covering, they're paying for my health care. And so there's an added component of advocacy there that maybe in a health plan, you may not even be sure who they are. And so you may not even recognize. Furthermore, like a lot of health plans don't have basic things like email addresses to contact you. And so we work really closely with plans to develop engagement and activation programs that do work.
So maybe a lack of awareness on the beneficiary's part.
Awareness is the number one thing. And then you have to catch the consumer at the right time. And that's probably the hardest part. And so that's where having preventative health programs, having a use case for when you're not sick is really important. And so our doctors can offer well visits, they can do preventative lab tests and screenings. So I don't need to talk to you only when you're sick and looking for care. I can actually have a relevant conversation with you on preventative care any day of the year.
I want to talk a little bit about Doctor on Demand as a business, because we've seen a ton of investment in telemed this year, and and also the end of last year. So how are you guys doing, and what do you think about this? It's this water is starting to get a little bit. It's not blue ocean anymore. So what are you doing? How are you guys fighting along?
Yeah, well, to be sure, a lot of money has been raised in this category alone, and I think it's because investors see the opportunity. It's a massive market opportunity. We estimate $70 billion some odd total addressable market in the U.S. alone. So the stakes are high. And when you're in healthcare, it's a capital-intense business, right? To build out platforms that can scale, that can deliver 24/7 care on demand is not an easy thing to do. It requires capital. It requires committed capital, investors who are committed to the healthcare space and understand it and understand that it will take, years and not months to get massive results. And so I think it's a great thing that there's appetite for that. There have been previous times in our economy that maybe they wouldn't have been as aggressive with funding ideas in this area. But it's a competitive space. It keeps us very focused on our customers. We see our customers as patients, payers, and providers. So we're very focused on having a strong value proposition for each one of those.
Where are you guys at? Are you raising right now, or are you guys?
No, we raised $74 million earlier this year.
Okay, and so you guys are cool for right now, and you're basically in expansion mode.
Correct.
Got it. Very cool. And then what are your thoughts on some of the other, like the bigger players who seem to be aligning themselves with those big health plans? I mean, how are you guys looking at that? I mean, I know you're one of them in some cases.
Well, yeah, there's a handful of competitors in this space.
Yeah.
Everyone is tacking on a slightly different plan, although we're on the surface doing a lot of the same things. I think our strategies are becoming a little more delineated over time.
For sure.
Yeah.
Very cool. Well, it's exciting to see how this market is going to shake out and how healthcare consumers are going to continue to utilize the service and, make it become ubiquitous. And hopefully maybe I'll find a primary care doctor this way.
Come see us.
I will definitely. Thank you.
Thank you, Jessica.
Hill, thank you. It's such a pleasure to talk to you. I'm Jessica DaMassa with WTF Health here at AHIP's Consumer Experience and Digital Health Forum. Thanks for joining us.